Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physician advocate, and she brings together Erin Hurley, physician coach, and Dawn Veselka, a patient advocate. Today's Kevin MD article is Spreading Hope, One Card at a Time, How Small Acts of Kindness Can Make a Big Difference for Doctors. Everybody, welcome to the show.
Thanks,
Thank
Kevin.
you. Appreciate
Good to
it.
be here.
All right, Kim, as always, how did you bring Dawn and Erin together?
Yeah, so I had introductory conversations with each of them last fall separately, a few weeks apart, and I learned about Dawn's Cards to Warriors program, and I learned how passionate Erin was about supporting her physician colleagues, and I thought they'd enjoy getting to know each other, and I had them on my YouTube channel the end of January, and we titled that episode Spreading Hope One Card at a Time, Uplifting Doctors, Patients, and Caregivers. And they really hit it off, and we wanted to collaborate further and make a big impact for Doctors Day. So we wrote our article, and I'll let them share their perspectives about some of the ripples that have come from our work together so far.
All right. So, Dawn, tell us about your Cards to Warriors program.
Well, first, Kevin, thank you so much for having us. We're so excited to be here. And Cards to Warriors was born out of a need to just meet people in the moment where they're at. There are so many amazing organizations that are doing great work with advocacy, Funds for a Cure, all of the big long-term projects. But sometimes we realize sometimes people just need a little bit of love dropped on them in the moment to say, hey, we see you, we encourage you, we know it's hard, you're having a really hard day or a really hard time. And we're just here to support you, send you love, and give you that little oomph to keep going on those super tough days. So that's really where it was born from. And it has just turned into this whole Magic in the Mail project where caregivers, illness warriors, and now physicians and medical professionals can just receive a little bit of love and encouragement that they can look at over and over again on those days when they need to be grounded and reminded of their purpose.
So, Dawn, give us an example of some of the messages that these healthcare professionals are receiving from your program.
So we have two different kinds of mail. One is handwritten mail. So those would come from the actual patients that have treated them. And those are obviously always the most rewarding. We're right now in the middle of our campaign that's called Thank Your Favorite Medical Warrior. So we've sent cards out, and the patients and the illness warriors and caregivers are receiving them, and they will write a message telling that doctor, that nurse, exactly why they made a difference in their life, exactly what about their care was life-changing. You know, for me specifically, my daughter's doctors, they saved her life. I mean, you can't be more grateful than that, that you saved her life. You've just nurtured her along the way, found things that would work when nothing else was working, those kind of messages. And then we also have cards that are just printed that we send in mass. And so those kind of messages would be like, everybody's a warrior in our world, whether you're a medical warrior, a patient, an illness warrior, a caregiver warrior, everyone's a warrior because we're all on this journey together. So they say things like, hey, warrior, we see you. We know that you deserve to be loved and cheered for. Thank you for your contributions that you're giving to all of us. Those kind of messages, just hope and encouragement and love.
And Erin, when you heard about this program and you're a physician coach, tell us a little bit about how you heard about it and what your thoughts were after hearing about this program.
Well, I just want to say Kim Downey has a magical way of putting the right people together. And so when she connected Dawn and I in January, and I heard about this mission, I sit on a statewide executive committee called Oregon Wellness Program that helps put mental health, confidential mental health appointments with vetted professionals in front of caregivers, in front of healthcare providers. And I also am on the board of my local medical society, and I'm on the wellness committee. So learning about this event actually started the wheels turning. And I was like, I remember talking to a good friend who was so appreciative of her cardiologist and her primary care doctor. They made life-changing adjustments in her and her husband's life. And I said, you know what? I want to write your doctors a card. And this was a coffee date with my friend 6 months ago.
Yeah.
So this planted a seed. And then when Kim said, you know, I wanted to write letters beyond my circle. And then we all came together and I thought, I'm going to start an event. I could host an event. I love planning them. And so we created an event called Notes from the Heart in Salem, Oregon, where I'm at. And the Medical Society sponsored it. Some local businesses sponsored it. We had a local artist who's a high school student create the artwork for the cards we printed. And it was such a beautiful event where patients and caregivers came together, writing notes to each other. And unexpectedly, I don't know if I've shared this with Dawn or Kim, one of my good friends that I've known since residency came to the event, and one of her patients came. It wasn't planned. We had people who nominated their physicians or their healthcare providers who came, and we knew that they were going to say some words. And the dad came up and said, hey, I didn't realize Dr. Pearson was going to be here. Can we say something about her? And his son had cancer multiple times, and she was the pediatric hospitalist that created the hospitalist program at her local hospital so kids could stay local and not have to go an hour away to be cared for. And it was such a serendipitous moment for this patient family to share gratitude, and then the physician to say what a meaningful impact that patient had. We had a card creating station where there was a whole group of toddlers there with their parents creating cards. So this magic that happened because Kim had the intuition to put the two of us together. And I see this as an ongoing, maybe annual event, or even I would love to host another event. It was just incredible.
And Erin, tell us about the morale in general of some of the physicians that you're talking to. And you mentioned the impact that this small token of appreciation had on that one particular physician. But in general, just give us a sense of what the morale is like. You're on the wellness committee, so I assume you talk to a lot of physicians and healthcare professionals about some of the issues that they're facing today. What's the morale like, and how can appreciation like this lift them up?
Well, I know that the numbers of physicians in burnout have gone down slightly, and yet there's still close to 50% in primary care, which is where I work, and in women in medicine, it's not great. And I just had a call with a new coaching client, and her life was so messy, and she'd just given up hope at making any change. And that seems to be the norm. One of the things I love as I started coaching mostly women in medicine and healthcare providers to get more done with less time and energy, to shift their perspective, take control over the things that they can control when they can't control the big corporate medicine, the morale can change, but we have to be in the right community. And that's where Kim, connecting different people coming together, your podcast, sharing not only the pains and the low morale in medicine, also those things we can do to turn things around, to get in community with other people who are not going to take things for status quo. And I talk about in medicine, we're used to, when you hear hoofbeats, think horses, not zebras. And for my people, I say, I don't want you to be a horse because the normal outcomes aren't really great right now with suicide rates and depression, anxiety, burnout rates. I don't even want you to be a zebra. I look at, let's create unicorns and a new norm where we can support each other and create something different in medicine. And by coming together like we are today, that just builds the momentum and increases the impact we can all have instead of trying to do it individually.
Kim, you have a unique perspective. You're a physical therapist, so you have that perspective from a healthcare professional side, but also you're a patient advocate. So tell us about the impact of appreciation. Is it done enough, do you think, among the healthcare community? And talk again about the impact through both of your perspectives.
Sure. So I think it's not, and I think everybody tends to take each other for granted. And it's so interesting because I was on my town's Facebook page. They have a local business and happenings page, but now I'm so busy on LinkedIn, I don't really go on anymore. But I remember like the last couple years, I wanted to make a big impact for Doctors Day. So a couple times I put a message on the Facebook page, like, does anybody want to join me? And there was like crickets, like one or two people, and it never got off the ground. But like if you say there's a lost dog or a new restaurant, like a couple hundred people will comment. But simultaneously over time, like if you wanted a new doctor, if you put in, oh, who's the best pediatrician, right? People will write like notes on that Facebook page about, these wonderful pediatricians. So they might, if somebody asks them, hey, do you have a doctor you like? They might share that, but they aren't sharing that with the physician. And I thought I could, kind of quickly just share how things can come like that we mentioned in our article about the butterfly effect, or as Dr. Todd Otten would say, ripples of change.
Hmm.
And speaking to your asking, like, with the impact that this has had, for those that haven't heard yet, Medicine Forward hosted an open space technology event prior to the Burnout Symposium in New York City last November, where we called the question, how can we restore and nurture the human connection so needed in healthcare today? And one physician raised his hand and he said, we have so much empathy for patients and we're expected to. Sometimes they don't understand our struggles. How can we foster empathy and patience for us? And a discussion group formed around that. And it was called Patient Empathy for Physician Wellbeing. And then the following month, we hosted a joint online event with the Healthcare Reinvention Collaborative, and I facilitated that breakout room. And we asked, what could we do? What should we do? And about a dozen people were in that room and they wished to further continue the dialogue. So I organized an online gathering in January. And when we met, I suggested we start right out of the gate by trying to make a big impact for Doctors Day. And again, we discussed what could we do? What should we do? And many ideas were generated, from wearing a certain color on
Hmm.
Doctor's Day to creating like flower bouquets with petals comprised of patient thank yous to designing social media profile frames and Zoom backgrounds. But we
Mhm.
thought simple would be best for this first go around, and we chose to get the word out about sending a note of thanks to a doctor who has impacted your life. And personally, I shared posts about it on LinkedIn, some of which were reposted, including my interview on Dawn's podcast, because then she interviewed both. I mean, Erin's
Aaron,
podcast,
yeah.
she interviewed both Dawn and I. And I wrote a letter to the editor of a local newspaper. An announcement was made at my church. The youth group wrote messages. And of course, I sent my own doctor's heartfelt cards of thanks. So all of that happened because one doctor raised his hand.
Yeah.
That's a wonderful
Beautiful.
story, Kim. Don,
Hmm.
let me ask. So Kim mentioned that when
Sure.
she asked for comments on her town's Facebook page about appreciating doctors on Doctors Day, there wasn't much response.
Hmm.
And sometimes I see that healthcare professionals often get lumped with all the problems in our healthcare system, and sometimes that
Yes.
appreciation is hard to come by, right? So, Don,
Yes.
what's your sense? Do you
Yeah.
find that sometimes it's hard to generate that appreciation for healthcare professionals, given all the systemic problems in our healthcare system?
Yes, and I think doctors a lot of times bear the brunt of it because the patient perspective is the doctors control everything at the hospitals or the clinics or whatever. And honestly, they have very little to do with it very often other than the direct patient care. So yes, we see that over and over again. Everyone's got their doctor horror story. They want to gaslight the doctors. They want to blame the doctors, but no one ever pauses and says, "Oh my gosh, but what is the good they've done? Like,
Mhm.
how can I show that gratitude?" Or even if they do feel the gratitude, they rarely take that extra step to show it. So poor doctors are just getting beat up every which way from the hospital administrations to the things they can't control. They're battling the number of hours spent just battling insurance on behalf of the patients, especially in our community where everyone's rare or unique and they're fighting for the drugs that they need for their treatments. The doctors spend so much time behind the scenes working extra hard, and they rarely get recognized or credit. They just get blamed when it doesn't get approved, or they get blamed when the patient has to wait, or they get blamed. Yeah, they bear the brunt of all of it. So that's a very good point.
And Erin, you're a physician, obviously, and I know when sometimes I get a thank you card or a gift basket from a patient, that's sometimes something that I remember for years to decades later. Maybe you can speak personally. Whenever you receive a note of thanks or a patient who goes above and beyond to thank something that you've done, how does that resonate with you? How does that stick with you?
Well, I practiced medicine for 25 years. I've retired, and actually, I'm looking at going back into practicing a special type of pediatrics. But when I received a drawing, when I received a card, I still have them. I would put them up on my bulletin board. And I remember sitting at my desk sometimes thinking, am I even making a difference? And then I'd look up at those cards and just realize sometimes something that I did that I had no idea the power behind. And that's where, if we can trust that people, we are having an impact, even when we don't see it, or we might see one tiny percent of it. If we recognize that's just one tiny grain of sand in a whole beach full of people who impacted their lives, but most of the time we don't get the opportunity to see that. And that's where I love this event and this ripple effect that was created with Dawn's organization, not just to the patients who need it, but also recognizing the care team, because sometimes it takes a tiny text, heartfelt, quick thank you. And it might take 10 seconds. And when I've interviewed individuals who've been suicidal, who have had significant burnout and depression, sometimes that's the one little event that turned their life around, and it might have cost you 30 seconds, 60 seconds. And so each of those little, it's like we can fill the tank back up. And, doctors are not robots. We are people, we're humans. And unfortunately, many of them are going through struggles as well. And the card writing event that we created allowed each other to see each other as human beings, not just in some 10 or 15-minute appointment. And when patients understand the constraints that physicians are going through and healthcare teams, many of them understaffed, under budget, all of these things, then they can recognize, oh, that's why there's this delay. Oh, now I understand, adding that human component, oftentimes just creating how can we help each other better understand. And then same thing goes for physicians, understanding the patient perspective, right? They're not just a patient or a diagnosis. They're a human being that needs our care and empathy.
We're talking to Kim Downey. She's a physician advocate, and she's brought together Erin Hurley, a physician coach, and Dawn Veselka, a patient advocate. Today's KevinMD article is Spreading Hope, One Card at a Time, How Small Acts of Kindness Can Make a Big Difference for Doctors. Now I'm going to end with asking each of you just some take-home messages that you want to share with the KevinMD audience. I'm going to start with Dawn, then go to Erin, and we always end off with Kim. So Dawn, why don't you go first?
Okay. First, to the KevinMD audience, thank you. Thank you for all your hard work. Thank you for your dedication, your lifetime of commitment. We don't say it often enough, but thank you for all that you do. And our goal is to bring together the patients, the caregivers, and the physicians so that everyone's working as a team. Everyone feels appreciated and seen, and like we're all collaborating together. And we're going to continue to show love and appreciation one card at a time for all of you.
Erin, your take-home messages.
Change is possible. And if you are experiencing feeling down, depressed, burned out, look at your community. And if you don't have the right community of support, go find somebody's community, reach out. Kevin's got this great community, KevinMD. You can get to a different place with the right support, whether that's a therapist, a coach, a friend, just looking for that, because you can make change. It doesn't have to take a long time. And it gets much easier when you have the right support.
And Kim, finally, we'll end with your take-home messages.
Sure. Well, I was thinking of you on Doctor's Day, Kevin. So again, thank you for everything that you do. And that we all know these are challenging times for doctors and patients. And some people are feeling discouraged and they don't think there's anything they can do. And from coaching, I learned to ask, is that true? Is that really true? What if the opposite is also true? And so we gathered a small group of doctors, patients, and healthcare leaders from around the country, and Erin and Dawn joined us, and we were able to make a huge impact for Doctors Day without needing permission from anyone. We just went ahead and did it. And our group is now in the process of defining our mission, vision, values, and name going forward. And I see us growing and forming small catalyst groups. So whether right now you're looking for more of like community support or a more action-oriented role or both, we can help you find your people. So just reach out to us.
Everybody, thank you so much for sharing your stories, time, and insight. And thanks again for coming on the show.
Thank you so much.
Great to be here.